So our next speakers will be presenting on careers focused on community benefits, community organizations, and access to care. Our first speaker is Adriana Aguilar, and she is the program manager for our fantastic Spirit program here at the Sierra Sacramento Valley Medical Society. And then we'll hear from Elissa Southward, and she is the Director of Community Health and Outreach with Dignity Health, Greater Sacramento area. So unless, Elissa, were you first? I just see that you're on now. Are you first, or is Adriana first? Couldn't remember.
I don't know, quite honestly. Whoever, I'm happy for Adriana to go first. That's no problem.
Okay, that's the deal. All right, Adriana, you are up. And guys, remember, you can ask questions throughout. I may or may not interrupt the speakers to ask your questions, or we'll save them towards the end. We do have a small activity for you all to participate in as well. So please participate. All right.
All right. Hi, everyone. Can everyone see my screen? I can't see answer. You know, if otherwise.
You're good.
All right. So, well, Lindsay introduced me, but my name is Adriana Aguilar, and I am the Spirit Program Manager. Spirit Program is a program of SSVMS. Real quick before I start my presentation, I just wanted to get an idea. We're going to be talking about access to healthcare, and I know access to healthcare and community health has been brought up in the previous presentation. So I just kind of want to get an idea from all of you or some of you. What does access to healthcare mean for you and for your family, for your community, for yourself?
To me, it means like for my family to be able to have access without having to worry about paying to get like healthcare.
Yeah, definitely. That's, you always want to, and this is something that's related to Spirit. So it's, needing to get healthcare without being afraid to get that bill, right? A lot of the patients that we see through the Spirit program, they don't seek healthcare just for the whole sole reason of they don't have insurance, no way to pay. So yeah, definitely. Anyone else? No.
I would say it's being able to have access to all kinds of healthcare. So we think of healthcare as just like going to the doctor, but it could also be preventative healthcare and access to nutritious foods, being able to go to the dentist and those kinds of things.
Exactly. Thanks, Abigail. Yeah, that's exactly right. Being able to seek healthcare despite your, despite your income or your lack of insurance, being able to access healthy food, right? So definitely. So, 1 second. Let me see if I can hide this. Can you guys see the bottom here?
But your present.
Okay.
No, we only see your presentation. You're good.
Okay, thank you. All right, so. The Spirit program. So as Lindsay mentioned, we are a nonprofit program of the Sierra Sacramento Valley Medical Society. We started in 1995, and our goal is to increase access to healthcare, specifically for the uninsured and low-income patients. So these patients are patients who don't have anywhere else to go. They need, and I'm going to go over primary health care, but specifically for us, it's specialty care. So if they need to see a specialist for knee pain, they have a hernia, they have nowhere to go, they don't have a way to pay. And a lot of our patients, the little that they do have, they need to pay their bills, need to buy food. And so of course they choose that before taking care of themselves. So that's where Spirit comes in. And we're able to do that with our awesome volunteers. So we have volunteer physicians and surgeons that donate their care. They donate their time and care and to do the surgeries completely free. And we're also able to do that because we have partnered up with the big hospital systems in Sacramento area, Dignity Health, Kaiser, Sutter, UC Davis, as well as Sierra Sacramento Valley Medical Society in Sacramento County. So we have all partnered up with the goal of being able to help these patients who have nowhere else to go. That their only way might be the emergency room, and even then we have patients who don't go to the emergency room because they don't want to get that $6,000 bill, right? Okay, so these are just examples of what we do. They're not limited, we do a lot more, but we're able to provide cataract surgeries, hernia repairs, knee surgeries. We do vision exams and free prescription glasses. So, a lot of times someone thinks, oh, we can get, they can go to optical, right? Walmart, get free cheap glasses. But again, those $100 glasses, it can be between using those $100 between, their bills and buying food or their prescription glasses. So that's where we step in. We donate the prescription glasses, we donate the vision exams, in addition to the surgeries that we do. And a lot of, I think social determinants of health was brought up in the previous presentation. So a lot of times having access to care means being able to get there, right? Being able to make it to your doctor's appointment, being able to understand the doctor. So if they speak something else other than English, that is a barrier. Transportation, I can't get to their appointments, that's a barrier. So we are able to help do that as well. We donate interpretation, transportation, anything that helps them get what they need. Okay, so how does it work? What do we do for InSpirit? So we work with the low income federal qualified health centers clinics in the area. So FQHCs, they are funded by the federal government, and what they do is they're called safety net clinics. They're specifically those for patients who are completely uninsured or underserved, and they have nowhere else to go. They primarily provide comprehensive primary health care, so that's primary care, dental care, and they're not allowed to deny care if they don't have insurance or they don't have payment. That's what these clinics are for. These clinics are here to help these individuals who need care. So a lot of times these FQHCs, they have something called a sliding fee scale. So based off the income of the patient, that's how much they pay for their copay. So a lot of these patients that are seen through us, their copay is $10. They're completely uninsured, so they're on the sliding fee scale. They are seen by the provider or the FQHC, so they get referred to us through these clinics. And what Spirit does after that is if the patient needs some sort of specialty care, they need to be seen by a specialist, they are referred to us. And we, using our volunteers, we see if we have a specific volunteer and if the volunteer is able to do the specific surgery. So for us right now, we're only able to provide donated outpatient surgeries. So what that means is any surgeries that are donated are surgeries that the same day that they do the procedure, the patients have to go home. So we are always looking to expand that, but right now that's what we do. And for me personally, as a program manager, if a patient needs more than what Spirit can provide, I do my very best to make sure they get it. So if that means working with the hospital to get charity care, that's what we do. So we ourselves we don't deny care just because we can help the patient. We try our best to be able to help the patient the best that we can as Spirit. So what we do from Spirit case on day-to-day, that would mean it's only 2 of us, but that means, we work with the patients very, very closely. The majority of the patients are Spanish speaking, and we help them anywhere from interpretation, transportation. We help make up their appointments, whatever they need. They can't pay for a certain prescription, again, because I know that's one of the other barriers that sometimes they can't afford a medication, right? So we're able to reimburse the patients. That way, whatever we can do to help the patients, otherwise they wouldn't be able to get the help that they need. One of the things I do want to emphasize is that Spirit does not do this alone. We are only able to do this because of everyone that collaborates, from our partners to the surgery centers, from our 140 plus volunteers, from the in-kind support that we get. So that's, pathology, if we have patients who have breast lumps, for example, they need pathology afterwards to see if it's cancerous, that's donated. So we're only able to do this because we work as a team. And that's what it is to work with community programs, where to help the community that truly needs it, is to work as a team, to collaborate, to make sure these patients who truly need it get the help they need. And that's something that we wouldn't be able to do for as Spirit without our partners. So since I did let everyone know, we started in 1995. So since then, we have helped almost 55,000 patients. We've had 1,300, almost 1,300 surgeries, over 44,000 hours donated, over 12 million in costs that's been donated. So when I look at these numbers, I don't just see 54,000, that's it. I see every single patient has a story, every single patient had a barrier, every single patient had nowhere else to go. And these patients wouldn't have been able to live their life without pain, without Spirit, and without our partners that helped us get that done for them. Specifically for me, for example, this patient that you see right here, he couldn't breathe, so he had to go see a pulmonologist. And we got that for free. He was able to get medication, and actually our volunteer was able to give him samples, so he didn't have to pay for anything. Without Spirit, he wouldn't be able to have got that done. Without our wonderful volunteer, he wouldn't have been able to get the care that he needed. So that's something that I'm very, very proud of when I work as the program manager, to be able to serve these patients. So real quick, the way I got into Spirit, I come from, personally, I am first generation. My parents, my dad, for example, he didn't finish junior high. They pulled him from junior high in order to work as a migrant farm worker. My mom didn't finish high school. And so my sisters and I, we are first generation. So for me, working in this program as program manager, these patients, I see my mom, I see my dad. These patients have nowhere else to go. And, if my parents needed something, I would have wished that there was something like Spirit back in the day to help them. And so every day when I help these patients, I do it knowing that I made a difference. So the way I specifically got to public health, or specifically the Spirit program, I went to Sac State. And I was actually pre-nursing before I decided to switch courses into public health. And these pictures are just a couple of internships while I did at Sac State. Here in the diaper picture here, I worked for Communicare, or I internship in Communicare. That's an FQHC in Woodland. I'm sorry, Davis. And I was in charge of the prenatal health. I was assisting them. So, we were able to get them free diapers. I did the education. And so these are just a couple pictures of part of my my experience at Communicare. I also did internship at International Rescue Committee. So at one point I wanted to do global health as my bachelor's. So International Rescue Committee, they work with refugees. So these refugees are coming from the Middle East, they're running away from the war. They have nowhere else to go. And so what I would do is I would take them to their appointments. And again, that's access to care, right? That's a barrier. They wouldn't be able to get there. I set up an interpreter for them because they didn't speak English. Whatever I had to do to make sure that they were healthy. So International Rescue Committee, they actually have an office in Sacramento. I know they also have in San Jose. They're a great organization. These pictures right here, at one point after I finished Sac State, I went to work for another FQHC, WellSpace Health in Sacramento. And I was in charge of the diabetic health education program. So these pictures right here are from the patients who finished their sessions with their certificates, and then we had a little potluck. And so during this time, I also worked as a patient advocate. So I was able to help the patients get free medication. Again, going back to access to healthcare, as diabetics, sometimes they can't afford medication, especially if they don't have insurance. Insulin is so expensive. So, trying to get them free medication, transportation to pick up their medication, So, you know, again, going back to my role in Spirit Program Manager, I remember I had a patient, one of my very, very first patients, and he had a stroke. And unfortunately, he didn't have insurance. So he didn't have that resource to go to physical therapy right away. He did end up having a slur when he talked, he couldn't walk right. And so for me, I remember the specific patient only because my mom had just had a stroke about 3 years ago. Fortunately for her, she had insurance. So she was able to go to physical therapy. When she first had it, on her right side, she was completely, she couldn't walk. I mean, she at all on her right side. And so because she had insurance, because she went to physical therapy, she can walk now, she can talk, she can even drink water. And so when I saw that patient, there was, you know, that could have been my mom. That could have been my mom, but unfortunately for her, she had insurance. Unfortunately for the patient that I was helping, he didn't have insurance. So I applied for charity care. We put again physical therapy to help. But again, it goes back to my role as program manager, I know I'm making a difference. And they're not just patients, they're just not numbers. They're, you know, each patient has a story, and each patient had a barrier, and each patient, you know, has, you know, their own health condition. So as Spirit program manager, that's, you know, that's what I do. And that's why I love what I do in public health. Okay, so I want to end the presentation with a patient story from Spirit. 1 second here. Bim, I might need your help on this.
5 years ago, I
Thank
wake
you.
up and I feel back my knees. Every time it's very more pain, more pain. And one day I say I can move in no more. I can sleep, I can walk, nothing. I can do nothing.
Letitia is a gal that is a very bad arthritic knee. She's working. She has become more and more disabled.
She has been in pain for 5 to 6 years, and we're really excited to be able to bring this care to her this morning.
We are going to restore this woman's life by providing a total joint replacement for her right knee.
The Spirit program accepts referrals from community clinics to provide donated care for patients who are uninsured, low income. We can only do that through our partnerships with our hospital system, Sutter Health, and the Surgery Center.
So our mission statement here at Sutter is to provide top quality care for and serving our community. So we like to give back to the community as well. So last year alone, we provided almost $1 million in charity care throughout our surgery centers. So we're very grateful to work with the Spirit program and very happy to see what we can do to help to serve the community.
Thank you, guys. You are my angel. Thank you so much.
The post-op recovery and the post-op rehab that is being supplied by Sutter are critical for a patient like this. So we're really excited that Sutter's involved in this project.
Have you been using the cane
Yeah.
since I saw you last time?
Yes.
Good, good. She's a hard worker. She never stops. She meets our goals every week.
I'm very happy for everything and for her because she's giving me a lot of hard time, but that's good for me. I work different and I feel very, very good. They changed my life.
Yeah.
Thank you so much.
You're on mute, Adriana. There you go.
Okay. So overall, that's it for me. Did you have any questions? I mean, I do just want to say one more thing. You know, when it comes to advocating for your community, you can do that in any role in healthcare that you decide to do. There's multiple ways that you can donate and give back to the community. Like I said, Spirit doesn't do this alone. So from the receptionist that checks in the patients on FQHC, from the medical assistant to the doctor, to the volunteer's office, to the interpreting services, everyone plays a role. And so when in whatever you decide to go into in healthcare, may that be specifically with the community or as a doctor, a pathologist, there is a way to advocate and there is a way to give back to your community.
Thank you, Adriana. I personally, this is the best program that we have at the Sierra Sacramento Valley Medical Society. And it's one that all of our staff members, even those that don't have the privilege of working on the program, we're all very proud of it. And we love to hear these stories. It's what motivates us. It's what keeps us going. And I did just want to point out that, and hone in on this, I think Adriana did mention this, but our program really is meant for those that are uninsured and are not able to get insurance. You know, most people are now, most people now do qualify to receive insurance or qualify for Medi-Cal. So those patients are not qualified for our program. So we really, truly are helping those that have absolutely nowhere else to go. And the majority of you're all on health insurance, but still, it's wonderful to have a program like this in our community. So if you have any questions for Adriana, I know Sam's going to share her email with you all in the follow-up email that she sends you guys every day. So you are more than welcome to contact Adriana directly. So Adriana mentioned that we have partners, and we are partnered with all of the healthcare systems in Sacramento. And I'm pleased to introduce to you all Elissa Southward, and she's the Director of Community Benefits for the Greater Sacramento area for Dignity Health. And she has one of the coolest jobs in the world. She gets to talk to nonprofits like ours. That's one part of the job, at least. Gets to talk to nonprofits like ours and you know, really make this a better community and make sure the community has funding and you know, they work on some wonderful programs. So I'll turn it over to you now, Elissa, and thank you so much for speaking to the students today.
Great, thanks so much, Lindsay. Appreciate the great introduction. I just want to make sure, is everyone seeing the PowerPoint slides? Okay, perfect. So I'm going to leave it like this rather than doing presentation view, because for whatever reason with Zoom, when you do presentation view, it makes everything go haywire and I can't see the boxes or if anyone has any chats. So hope this is okay and folks can see well. As Lindsay said, I'm a Director for Community Health and Outreach for Dignity Health's Greater Sacramento market, which is the 6 hospitals that we have serving Sacramento, Yolo, and Nevada counties. 4 of those hospitals are in Sacramento County, so a lot of presence here. And as you saw in Adriana's presentation, 2 of our hospitals in Sacramento, Mercy San Juan Medical Center and Mercy General Hospital, are part of the Spirit program and integrated into that work. And we are so proud to be a partner in that amazing program. So I'll start out quickly. I was asked to give you all a little bit of insight into how I got to where I am in my career. And I will just say that my pathway here into the community health space was a little bit different. So I want to be super clear with you all that while I do have a PhD, as it says on this slide, you absolutely do not need one to work in community health. So that just was how I sort of got into this space in a long roundabout way. I thought I wanted to be a professor and be in academia. and realized after I went through the PhD process that that really wasn't for me. I really wanted to be part of the work happening on the ground and part of programs where I can see like real world change happening. And so after doing my PhD, I went into work for a bike and pedestrian advocacy organization in Washington, DC, and lived there for a while. And it was a really great experience. And that's where I first came into the world of understanding around community benefit. And I'll describe to you all what that term actually means in just a minute. But I was introduced to that space because my role at that organization was really bringing our health partners and our economic development partners together alongside the bike and pedestrian advocacy folks to really collectively make an argument for why we need to be mindful of space where people can go outside and be active, where people can, sidewalks so folks can go outside and walk to various destinations without having to drive everywhere or use motorized transport. And so, after becoming aware of the work that, community health and community benefit folks do within the health systems, I was able to get a job up in Washington State, working in a community health role up there for a system called Virginia Mason, and then moved back down to start here at Dignity Health in my role about 2 years ago. And I was born and raised in Vacaville. So it was really a decision to return home to California, back to this area, and really happy to be working for Dignity Health. Especially, Dignity Health has a deep history and mission in serving those most vulnerable in our community. And so just wanted to kind of frame that out, that's how I got to where I am. But, the community health space, there are many inroads into that area, either, at a hospital or health system or working in the community, in community health for one of our nonprofits. And I'll show you a few videos later on in the presentation about how exactly we do that. But just wanted to give you a kind of overview understanding of what community health in the hospital system or healthcare system is. So really, my job and the role of our team is essentially to bridge and transition care outside of the hospital. So as you can imagine, when you come to the hospital, you're seeking medical care. But I know there's been a few comments that were made at the start of the meeting about how important those other things are for your health and well-being. So things like social services, making sure that you're able to get, you have active transportation, you're able to get to the places you need to be, that you have dental care, that you have behavioral health support, that you're able to connect to your primary care doctor, that you're able to get support if there are challenges with substance use. And so what we do is work very closely with community partners all across Sacramento County and in the other counties that we serve, who are really specialists in providing those types of care. And we help bridge and create programs so that folks are able to easily transition to accessing those other types of care. And so we're really trying to engage the community voice in that. And, a big part of our role is really understanding what is that community need. And so one of the roles that we have in the hospital is working on the community health needs assessment. And I'm happy to share a link to that, to this group so you guys can see it. It is a publicly available document. It's one of the requirements of nonprofit hospitals in order to maintain your nonprofit status. We are required to do one every 3 years, and it's a massive report that does a lot of data collection and a number of surveying across the community, really to gather as much information as we can to understand what are the needs of the community and to get community input into telling us how do you as a community prioritize these needs. And then what we do is we look at those needs, and then we're able to make decisions about programs or some investments or collaborative work that we can do together to try and make improvements in those areas. So as you all are from this region, it should come as no surprise to you in the last report that we did, access to care, behavioral health, substance use, homelessness. Those were kind of the top areas that we found. And those are really big community challenges. They're ones that take multiple partners focusing on and multidisciplinary partners. So folks from all various areas in order to help us kind of determine as a community how we're going to impact change in those areas. So it's not solely a healthcare issue, it's really a community issue. And so our role is really that kind of bridging to the outside and finding partners to help us move the dial on some of these really, really important priorities in our community. And so just a bit about the nuts and bolts. I mentioned community benefit. That is an actual term. So it's a specific term that the IRS uses. So as a nonprofit hospital, we are actually required to do certain things by the IRS in order to maintain our nonprofit status. And so all of that is accompanied in some of these community benefit policies. That's sort of the term. We don't really use that. Really, we use the term community health because it's so much bigger than what we're required to do here. But I just wanted to make you all aware of this if you hear this term, so you have an understanding of what it is. I added all the rules and regulations. You can look them up. It's all in really dry IRS language. So I don't necessarily encourage anyone to go down that rabbit hole. But in essence, there are requirements of us as a health system to make sure that we are providing adequate financial assistance, that we are caring for folks that are part of the Medicaid or Medi-Cal system, folks that are part of the Medicare system, and then other community services, which are really the pieces that me and my team kind of manage and coordinate. So those are community health improvement services. We do a lot of internships in health profession education. We have residency programs. There's also certain programs that we provide at a loss to our system because they're important in the community. So things like behavioral health, those are not things that get reimbursed particularly well, but we go above and beyond because we recognize it's important and it's crucial. And then, we do have grants programs where we make, cash donations to community partners to let them kind of design what they feel like is the most appropriate programs to tackle some of these larger community needs. And then there's some elements around community building where we can make, investments in walking and biking infrastructure, other things that are really kind of outside of what you would class as typical health issues, but they're allowable things that we're able to do as a health system. And then, as I mentioned, we do our community health needs assessment. And then there's also some specific work that we are doing around homelessness as part of a new Senate bill that was passed a couple of years back. And so, it really creates for all hospitals across California a very strict understanding of screening and the types of services we're providing to our homeless patients. So making sure that, if and when possible, and if they choose, they are discharged to some sort of transitional housing or a motel where they can get a few nights stay. Some people, to be totally transparent, want to be discharged back to the streets, and that's something that we allow, but we do make sure that if they are wanting to be discharged back to the streets, they leave us with clothing, clean clothing, they leave us with food, and they leave us with any medications they might need to further their care. So I wanted to make sure that you guys didn't just hear me drone on and on for 25 minutes. And so what I've done for the latter part of this presentation is queued up some videos that really highlight the programs that I'm talking about so that you can hear from those community partners more about those programs, because I feel like that's way more interesting than having me try and tell you. And I know Sam has those queued up, but I want to just sort of lead into these and then I'll stop sharing so that we can cue the videos. So we, as I said, really design programs around those most pressing needs in our community. And so the 4 videos that I'm going to show you are really snippets of just a couple of programs, right? We already talked about Spirit. That's a program that we're part of. There are many others, but these are just 4 examples. The first one specifically having to do with mental, behavioral, and substance use. And it's called Rapid Access to Wellness. This program is specifically up in Nevada County. But I feel like it's one of our ones that we like to highlight. It's amazing. And we have collaborative partners that are really invested in that program. And so thought it would be a great one for you guys to see.
What we realized is that we had a real problem in our community.
Like so many communities across America, it was substance use disorder that was really devastating our families and our community and creating environments that challenged our children to grow up safe and healthy and strong.
What we wanted to do is give officers tools to literally meet people where they were, and rather than sending people directly into incarceration, put them into treatment, because the reason for their criminality and maybe their homelessness was really their substance use disorder.
If we get them in a healthy frame of mind, we get them in a healthy environment, we can help them heal, and they will be some of the most effective contributors to our communities.
With the progressive thinking of Grass Valley Police Department, with the partnership in funding from Dignity Health, we actually had a 61% completion rate of people successfully meeting their goals in treatment, which means completing the whole program, means being free of substances, means also achieving these other goals that are set out for them. 61% of our folks, which is significantly higher than the national average, and looking at a population that is facing tremendous challenge, to have those kind of outcomes is really kind of affirming.
When they're desperate, it's the best time to help them. Strike the iron while it's hot, so to speak. So this allows us, this partnership with Dignity allows us to perform these services when they're needed. It's an amazing and inspiring story that just repeats itself experience after experience.
I'm a veteran. I had some issues, some mental health issues, and I was this stone cold heroin junkie. I was completely broken. I was homeless. I had nothing. I literally had everything I owned in a bag and had Lenny. You know, I felt like I was going to die, and this was my chance to live. And so I went through the program. It was amazing. It has given me tools to deal with some situations that I can't believe that I've made it through sober and clean in the last year.
It's just like a family setting, is what it really felt like. And I immediately felt comfortable and was able to open up and get vulnerable and start working through my stuff, you know. I learned how to be me. I learned how to be me again. And
if we can really move the dial and help our families that are experiencing substance use disorder, which is pretty much every family, we have an opportunity to, in doing so, address so many of our most pressing social challenges.
Globally for us, that really makes us meet our goals to reduce crime and improve the quality of life in our town.
Where there's life, there's hope, and no one is too far away or too far off to be healed. We're restoring humanity. We're reminding people of the things that they've forgotten, is that they are valued and they're cherished. And we're restoring people's dignity. And we get to do it with kindness. So we couldn't do that without the partnership with Dignity.
Awesome, thank you. And so the next video that I have for you guys really highlights a program that we have available at all of our 4 Sacramento hospitals, actually all 6 of our hospitals, and it's patient navigation. So we partner with an organization specifically for Sacramento, Sacramento Covered, who really are experts in making sure that folks are getting connected. These are community health workers. These are folks that are particularly trained at talking to patients and making sure that they are getting connected back to primary care. They're getting enrolled in Medi-Cal if they're eligible and they're not on it. They're getting some of these bigger barriers worked out to be able to better access care. I will pause there.
Sacramento Covered, we mitigate the barriers to healthcare by educating, by empowering people on how to use and utilize their insurance. We assist low-income, underinsured, and uninsured, also linguistically and culturally isolated individuals, and those that are experiencing homelessness. We empower patients so they can be proactive about their health. We want them to be able to navigate all these barriers on their own, and and if they need us, we're always there to help them.
My name is Juan Carlos. I work as a patient navigator at Dignity Health. My role as a patient navigator is to be able to help patients who are coming for non-urgent care to the hospital connect them to the primary care doctor. Every day I go, the first thing I do is just go and see if there are patients in the floor who are in need. You don't have to say much, but by your body language, right, and the way you express, you are just basically telling the patient that you care. And when they notice that, because everybody can notice it, it's very easy to them to lose their fears and to trust us, in order for us to help them.
I think what's really important is that because we are funded by Dignity Health, that allows us to approach the patients in the ED. And I think that's crucial for that population we serve. Most of these patients, they're not aware that there's an issue until we go out there. If it wasn't for us approaching them, I don't think they would be calling us. It's that in-person approach that Dignity allows us to do, that I believe that's why our program is successful.
Best collaboration we can have. Yeah, because we share the same values. You know what? Everyday doctors, nurses, like all the staff, prove to me that they do care. I can tell you one that I always think about it. It's about a man who had a chromium separation. Basically, the socket, it was just out of the socket, right? And the ligaments were torn. Basically, he was lost because he didn't know he had a primary. He didn't know all the benefits that he could get. He did surgery. So I worked really hard. We worked very hard as a team. We always connect to each other, if we don't have the answers. And we were able to make sure that he was able to be seen by a doctor in 2 days. And he was seen by the specialist, the following week. And now I know that that person, had surgery. It's okay, he's doing well. And he appreciates the fact that we took interest in, his health needs. And so I never forget about that.
I had a patient call me back a year later just to say, I was just thinking about you, and I just have to say, thank you, because not just you, but everyone in that room. It was a patient that was very hesitant about a procedure, and we just didn't know why. I mean, it was like all of us were around, and he just kept saying no and no. It was a life and death situation because he wanted to be discharged. And I told him, well, the doctors are saying if you're discharged, you may not make it home. He said, you guys weren't my angels because you convinced me. If it wasn't for everyone in that room, I would have left. And who knows what would have been my fate. The techs were there, the RNs were there, the provider was there. We were just informing him of what his situation was. And so it did take all of us for him to stay. It just proves that it does take a community to help the underserved. I just thought that that could have been my father. And there was no one to help him, or it's just I do feel that responsibility. It's my job. I have the knowledge. It's why not share the knowledge with them, empower them? So it's gratifying to hear those stories.
It's basically about walking with them, to making sure that they're going to have access to healthcare. And not only to healthcare, but actually to every single resource that they may need.
Preventative care is essential for you to be healthy, for you to be there for your family. It's everything. If you're healthy, your family's healthy.
Awesome. And I think we've got time for one more. So we'll go to the next one, which is something that's really, this partnership is really near and dear to us. We have, specifically in Sacramento, we have physicians that are part of our Mercy Clinic, which is a collaboration with our Methodist Hospital down in South Sacramento, who are really national champions in the human trafficking space. And we have really taken on human trafficking and Dignity Health as a real priority area for us, and making sure that there is wraparound care and a safe place for victims of human trafficking to receive care and access the other supportive services that they might need. And so this just highlights a really wonderful relationship that we have with Weave, who is an amazing violence prevention, domestic violence, human trafficking partner in our Sacramento community.
One of my sorority sisters was sexually assaulted in college, and I watched as it ruined her life. She dropped out of school, moved back home with her parents. I didn't see that there were any resources for her. It didn't seem like there was any support for her in the community, and it bothered me. When I found Weave, I discovered that there was a role for me to actually make a difference in the life of people who had experienced sexual assault, and that I could build an organization that provided support and resources for the people who had been victims and the people around them who were confused by the crime of sexual assault. I'm Beth Hassett, and I'm the CEO of Weave. Until I feel like everything's all fixed and there are no more victims out there, I'm going to continue to come to Weave every day and do what I can to make a difference. Weave serves 3 different types of victims in our community: domestic violence victims, sexual assault victims, and victims of sex trafficking. We offer residential services, so housing for people who need to leave their home because it's dangerous. We also offer counseling, individual and group therapy, and our legal services. We're one of the only resources for people who are trying to get a temporary restraining order or are dealing with domestic violence and child custody and a possible dissolution. We also provide a lot of education out in the community, so we're trying to prevent these crimes in the next generation. So we're working with youth to see how we can stop these crimes before they start. So we serve everybody in the Sacramento region and touch a lot of lives. Weave has a long history of working with Dignity Health through sponsorships of events and that sort of thing, but we have a really powerful partnership with the Mercy Family Clinic. We are responding to the hospital when people are getting their exams, and it's everything from a 13-year-old to somebody who's 65 years old. We have an advocate who's embedded at the clinic and has worked over the past 2 years to really change and shape the culture. The leadership there, Dr. Chambers, is amazing and really is trying to create a trauma-informed medical home for victims of sex trafficking. There is incredible power in marrying service providers like Weave, who are serving victims of domestic violence and sexual assault, with your more traditional medical providers, and looking at the whole person that way. By bringing everybody together and having the trusted service provider and a trusted medical provider, it creates this symbiotic relationship that makes everybody healthier and makes our community more whole. People don't realize that they know somebody, probably in their own neighborhood or at their church or in their workplace, who's a victim of domestic violence or sexual assault. I think the biggest danger is not talking about it. And if we can all be active, looking out for each other and making sure that victims are believed and that they are pointed in the right direction towards help, we'll be a more compassionate, empathetic, and safer community.
Awesome. So that, I think, is all we have time for in one more video, but I know we want to leave time for questions, and then I know Adriana has an activity, so we will end there. Thank you guys so much for having me here today to speak to you. Really excited to have been part of this, and happy to take any questions if there are any.
Yes, please either type them into the chat or raise your virtual hands if you have them. I know it's late on a Friday afternoon already, but I just want to say that this truly is the best part of what all of us do. We are a part of healthcare, We're not the ones actually that are clinicians that are providing the care directly, but what we do also matters. And I gotta say, it's a wonderful feeling to know that what we're doing absolutely is making differences in so many people's lives, in our neighbors' lives, and our friends' lives. And it feels good at the end of every day to talk about and know that we did a good job and we made a difference. So if there aren't any questions, and looks like everybody's all questioned out, especially after you missed it, Elissa. Dr. Williams had quite the presentation on vascular surgery before you were on. Yes, it had lots of beautiful pictures. Adriana, I'm going to go ahead and turn it over to you because I know that you had an activity that kind of followed up on your initial question regarding access to care and what that means.
Yeah, so I just want to go back to that initial question. What does access to healthcare mean to you? And just dig a little bit more now that you heard my presentation, Elissa's presentation, and how we work with the community, all the different ways they work with, the uninsured, or just the community and whatever that they need, access to healthcare. So now that you've heard that, going back to that question, what does access to healthcare mean to you and your family and your community? What changes, or what would you implement to change your community, or to add resources, to improve it, to for you, for your family, for your friends, for your community? What would you do? It can be anything. It can be simply advocating, reaching out. It can be, maybe creating some sort of program.
Abigail raised her hand.
I think
Go ahead, Abigail.
Sorry, did you call on me?
Yes.
Yes, I did. Go ahead.
Okay, sorry, I got confused. I think when there should be more, how do I say it, more cost effective and even free access to women who for emergency access for women who get sexually assaulted and raped. Because like the emergency room bill is crazy expensive. And like you think about the women who are at risk for getting raped and sexually assaulted, like for example, women who are in prostitution, they don't have insurance to cover that. So there needs to be more free or lower cost emergency services for women who are sexually assaulted and raped.
That's a great answer, Abigail. Anybody else? Dr. Williams or Elissa, feel free to chime in as well.
Yeah, this is Dr. Williams. It's another reason why sex trafficking has been so unrecognized, because these folks tend to not have a voice and they tend to be invisible. And while we see some of them here, they are moved around throughout the country or throughout the coast, and they're considered disposable. So having someone pick up and care for them and give them a voice and take care of them is so critically important.
There's a comment in the chat that it would be nice if schools had presentations or talks about these specific programs as well, to let our future know about these resources that are available to them.
Yeah, it would be great. And we've had physicians involved in this give us presentations at Sierra Sacramento, and I can see easily how this could be taken to the schools, because these are the guys who are going to be able to help us. They're our eyes and ears, and they will frequently bring things to our attention first. So we are depending on many of you to let us know what's going on out there. If there are topics that we are not covering in this program, please let us know, because we do want to hear from you. We want to make it better next year and the year after that. So you're our ambassadors. You're also the ones that will tell us what we need to work on.
I think in follow-up to what Dr. Williams was saying and what Abigail mentioned, I think one of the things that we have recognized, I think more so now than ever, is really having those partners working alongside us who are expert in these spaces, and especially those that work with navigators or community health workers with lived experience, because, you know, as a health system, as a hospital, we are experts in the medical care, right? Someone comes to us with an issue and we fix it. But there's no way for us to possibly be experts in all of the various complex issues that are facing our communities. And so it's even more crucial for us to strengthen those partnerships and bring everybody to the table to work on some of these huge, big, hairy community problems, for lack of a better term. I mean, something like behavioral health issues or substance use or human trafficking is not something that any one of us can, solve on our own. You need all of the partners at the table participating in that work. And that is why, for our programs, it's so important for us to have community partners being experts in that space and sitting at the table with us and providing some of those wraparound services.
And just to follow up to that, I mean, I think I'm hearing a theme here. There just needs to be more programs. There can't be just one program that is working on one area. There has to be multiple programs, multiple different approaches to working on all of these different barriers to access to care. The Spirit program is not enough. It's a huge organization, but it's also not enough. We just need more people to have the drive to work on this. So Abigail, I see that your hand is up. Please go ahead.
Sorry, I know we're running low on time, but something I think that needs to be more implemented. I know we saw it during coronavirus, but mobile clinics, because we see that transportation is an issue. But also, you can also do education mobile clinics, because we can't expect people to just know things. I mean, to a certain extent, right? I kind of understand why people would be hesitant about getting a vaccine if you don't know anything about it. So you need people to come and educate and then maybe give the vaccine along with it, to go to those areas that can't go and just get it and don't have access to it.
Yeah, Abigail, you're absolutely right. To add on what Elissa said, collaboration, but it's outreach. Knowledge is power. And one of the things I know when I work with patients is teaching them how to advocate for themselves. And they don't know how to do that if they don't know what's out there for them, this is their patient, their rights, and that they can ask questions and outreach. That's one of the big things for public health is outreach. When you connect with these communities, we need to reach out to these communities. May that be vaccines, human trafficking, whatever the subject is. Outreach is the key to teach the community what there is and the resources and the rights. And like you said, if they don't know what's out there if they need assistance.
Yeah. To add to that, I think as we reach out to the communities, we need to have someone from that community or someone who's trusted and familiar with that community taking the message to them. It's the same with speaking to students in a high school. One high school student speaking to another will be heard better than an adult speaking to the high school student about the same topic. So if some of you on this program now are willing to work with us and there are issues that we need to deal with and take to your high school and you want to be part of it, let us know, because we can always use your help. You can make a huge difference.
And one final thing I will say, we have some amazing people in Sacramento doing the work on the clinical side, on the social services side, on, just our community partners, our nonprofit partners there's so much passion in this community, but to be completely transparent with you all, there is not enough resources. So, you know, to Lindsay's point before, we would love to put tons of programs in place, but there just isn't the resources to do that. So we are more and more having to do less with more, or sorry, more with less, to try and tackle some of these huge issues. But we are really excited. There's some new funding and some new regulations and policies coming down through the state and through the new Medicaid waiver program that's going to be available here in California. And so we are incredibly hopeful that in the next few years, we'll see some progress towards having some additional resources to invest in our most vulnerable populations in our community. Because we just, you know, we hear time and time again from partners, we just don't have enough here. We have a lot of populations that are really struggling and just not enough resources. So, you know, the more we can work with partners and be really creative, the better for everyone. But keep your fingers crossed. We will hopefully see some additional funding coming from the state and a few other resources soon.
And that Elissa ties it back to yesterday's talk was about advocacy and policy and how that works. And we had our head lobbyist at the CMA talking to the students. So again, tying it all back together on why these subjects matter and what careers are available to you all if this is the path that you choose to take. So students, please help me thank Elissa and Adriana for their fantastic presentations and just the amazing work that they do for our communities. And I truly am grateful to know both of you, and I do appreciate you talking to the kids today.